Okay, good afternoon, good evening to us all, depending on where you are joining us from. We are very excited to have you on today's call. Today's call promises to be very, very interesting, very, very amazing. Without wasting much time, I would want to call on Dr. Dikshanta so he takes us through today's interesting webinar session, dubbed AI in Medical Research. So over to you, Dr. Dikshanta.
Thank you, Isaac. Hello, everyone. Good morning, good afternoon, good evening from wherever you are. Welcome to today's session. Today, we have a very interesting session, Artificial Intelligence in Medical Research. So previously, we conducted two sessions, one in case report writing, another session was about clinical research. In today's sessions, we'll be talking about the use of artificial intelligence in medical research, which is a very important skills that are required at present. And today we have a very special speaker. So Maladeep, he is the regional coordinator from Asia and Oceania. And talking about Maladeep, he is a data consultant and educator with a background in computer science from Kathmandu University, Nepal, and holds a Master of Science degree in data science from the Coventry University, UK. He is a part-time senior research lecturer for Birmingham City University at Sonway College, Nepal. He works as a data consultant for several national and international organizations on data visualization and analysis projects. His firm, Dataksha Analytics. I guess I spell it right, Mala. His research integrates methodologies from data visualization, human-computer interaction, machine learning, visual analytics, and data mining to tackle social context issues and develop methods to make complicated systems and concepts easier to use and comprehend for both professionals and non-experts. Mala also leads data science and visualization boot camps across Nepal through his organization, contributing significantly to the local educational landscape. And he is a very proud member of our WMI community. We welcome him to this session by Medical Scholar Board. So over to you, Mala. Welcome to this session.
Thank you so much, Dikshant and Isaac. Let me just open my video. So yeah, hello everyone. Let me share my screen first and then I'll. Okay. Start to. Okay. I hope you guys can see my screen, right? Yeah. So let's start. So hello everyone. Let's everyone is doctor I think here, right? So on today's session, I'll be talking about the use of AI. It's more kind of application. Before that one, how many of you already know about ChatGPT? You can just write in now like comment section. Okay, hands off. So that's good. So today's section, we'll be talking about the AI and use and everything. Let me just okay. So before you listen to me, why you have to listen to me? Like because I have been as a features author for like almost 1500 author in data science in medium.com. My work, especially data analysis and then visualization, everything has been on the like data visualization society top 30 around the world. And the one visualization that I did here, everything it has achieved analytics art award from Italy. So that's all. And especially I work in discipline of computer science, but data science, visualization, and academic research. So today's session, I'm especially focusing on AI for medical doctor. So as you know, most of you, if you are into a research part, you already know PubMed, right? So there are like 34 million or plus PubMed articles, 4,000 plus clinical trial, and 73% of research has been reported that it's been overloaded with information. So if you even if you have to do a literature review, you have to kind of it's so hectic for you. Like how many people you are going to read? It's so much stuff. So With AI, what we are going to do is like how to search smarter, how to write better, how to analyze faster, and how to present clearly. Right. So if you cover, we will cover these four things, and for that we will try different AI tools. Before that one, here are two approaches, one and B. There's A and B, right? If you see, these are the both answers that come from the chat GPT. I just tweak one statement and then the result are totally different. If you see on the, sorry, okay, if you see on the section A, the answer is more like it looks like kind of AI only. But if you see on the two, over the past few cohort of teaching data and one pattern has stood out clearly. So it's more like a human form, right? So here, if you see teaching data and has been one of the most rewarding part of my journey. So I just changed a few terms and you will have a better result. So on today's session, we will be learning about this one. So we'll cover a few tools that tool are more for search, analyze, generate, optimize, and everything. So especially like after this session, if you want to have a complete medical research workflow, you just need 12 tools, and that 12 tools will cover everything. That means like for medical literature review, we will be using Perplexity.ai, Consensus AI, and Elicit. For drafting and summarizing, we will be using ChatGPT and Gemini. For analyzing like deep paper analysis, we will be using Explain Paper, Gemini, Claude, and Elicit. For data analysis, Julius AI is the like one of the like top most tool from my preference. For research knowledge base, it's Notebook LM. And for conference infographic presentation, we use Gamma app or Napkin. For full medical research pilot project, we'll be using all these tools, but more like in a in an approachable manner, right? So I know like the few tools will be might be new for you, or few tools will not coming from your side, because I have no idea about the tools that you are using. So if you are using anything apart from this, please do write in our chat. So if you know, as a researcher, we will be following IMRAD format. So introduction, method, result, discussion, and conclusion of the paper, right? So as a researcher, we have to pick AI tool that complement those section of our research. So in order to define a research question, we'll use tool like ChatGPT to formulate a better research question. For literature review, we'll use Perplexity. Now there's another tool called Semantic Scholar, Elicit, right? For screening paper, which paper are very good, which paper have different things, we'll be using Elicit or Rhine. For understanding paper, we'll use explainable paper or size space. Like if you see, like there are lots of tools, but you have to pick one tool that is free, and of course like that is workable to you. So these are the tools that I use actually. And for extracting data, you will use Elicit and ChatGPT. For evidence synthesis, you will use synthesize extracted tool like Consensus AI or ChatGPT only. For organizing, you can use Zotero, like, or reference management, any other thing, Zotero or Mendeley, whatever you feel, or MyBeep. But you can also use Obsidian. It's very new one, but that's very good one. And for drafting paper, you can use ChatGPT, or there's another one that is very good. It's called Rightful AI. For visual, you can use BioRender or Canva, right? Or even Napkin.ai. For presentation, you will use Gamma or Tome. And for final, you will collect every output from this AI tool, and then you will present that one. So that's the actual flow, right? So let's jump and see few example. So the first AI tool that we will be using today is Perplexity AI. Previously, we will open PubMed, we will type a keyword, and we'll get lots of result. And then we'll spend 3 or 4 days or 5 days reading lots of paper abstract and then doing lots of things, right? So the main essence of AI is not to replace the tasks that you are doing. The main essence of AI is to make something faster, so that you will finish that work in 1 hour, right? So now, sorry, okay, let me let me go to the Perplexity.ai. So Perplexity.ai is simply Perplexity AI. You can search this one and you can create the AI. So let me first show you. if I have to search anything, what I used to do, like let's say anemia, I like this is kind of hands-on program, right? So if you are in front of your computer, I'm sure not from the mobile. If you are in the computer, just open your new browser tab and do like mimic what I'm doing. So search for anemia detection in children of, let's use example of Kenya. So I'll search this animal detection children of Kenya. Then I'll see PubMed Central. I'll open this page in new link. Then browse. I'll read this paper. I'll go through. Open this paper. I'll go to GOL, Google, other part, Oxford Academia, right? Then what I'll do is like I'll go and see and read and go through all this paper again. Go through all this paper, right? I have to go multiple download, multiple read and everything. And this will also do two things. One, it will consume your time because you have to spend much time. Second, it will also consume your own browser. Why? Because you have to open lots of pages, lots of link, lots of tab. If you see, if you are doing some research project, you will always see most of the tab are being pinned on this side. So now what's the better way? Now what's the better way to do is like you will just copy this one, you will go to Perplexity and you just enter that one and hit enter. Now, what Perplexity will do is that it will replace the searching part for you. So it will give you all the data from different pages, and it will also give us link. See, if you click on this link, you will see the sources, how many sources it has used. So anemia among Kenyan children, a call for improved monitoring and intervention. So this is from Oxford Academia. I think we have opened Oxford Academia already here. See, I open Oxford Academia after opening all these three link and then finally here. So if you see Oxford Academia came on Google second page, right? On top one. But when you do a purpose search, it came on the top first. So this is the first link that's good. So it means that this is more kind of relevant or more kind of top notch. So here, what you'll see, like it will give you an answer faster way. It will replace your Google search, and many people are using it as replacement of a Google search. So you will everything. Now you can ask follow-up question. Best methodology for study of this. So I'll just ask for continue version and it will start based on all this relevant, it will give one. So you will have like 17 sources. So see, you already have 17 sources as your literature review. You already have skipped through the 17 sources and you got your answer here. So what is anemia, the guideline, the detection method they use, and the key factor from different paper, right? And here you have study design, and it gives like use a two-stage cluster sampling, random select enumeration area EH. So you already have few idea. So before you try to formulate a read paper and try to note down like drunken method or other thing, you already have everything here. So data collection, the analysis method and everything. Even if you ask like you have your own research question, you type your research question and it will try to amend according to your research question and give a paper and other things. By here only you have all the paper here. And the main beauty part, you might say like, okay, I can use ChatGPT for this also. The main difference between ChatGPT and Perplexity is that ChatGPT, its name full form is Generative Pre-trained Transformer. It means it generate, right? I don't know if you have seen Paul E. Hong Kong. So if you have seen the Professor Paulip, so this is a very good, like very good example. So Professor Paulip from the Hong Kong, he have to step down from associate deanship after AI gender reference scan. So what they do, like his scholar uploaded a paper into ChatGPT, and it gives few 5 or 7 references that is never exist in the website. So it's totally AI generated because of the pattern. It looks same, but it never exists in the internet. So because of that, ChatGPT is not reliable for the research. It is reliable for the generating content, but it is not reliable for the research part, for the literature review. So that's why you have to use Perplexity because it gives you the main sources of the text that it has retrieved. So it will not give you a different thing. So in technical term, we call it AI hallucination. So hallucination means you all guys are like into from medical field. So hallucination will not happen in Perplexity. So this is the very good tool. And even if you have to search for the image, you will just click on the image, you will see lots of images here. Even if you have to click for the link, you will see all the links here. If you have to see the answer, you will see all the answer, the sample size calculation for anime and Kenyan citizen. It will not just be in one page, but it will be of different research paper. It will do the searching part for you, like going through all these Google, all these pages, like up to 10 pages, everything, and it will give a best one, right? So this is the first AI tool that you can use instead of going from personal manual work. Perplexity will be your tool, and Perplexity is not just dependent on that one. If you want to, like, let's say I am buying iPhone 17 Pro Max second hand, and battery health is 78, battery health is 76 percentage, should I buy? Now what it does, like, it will search for the forum and everything, and it will give you like whether that is good or not. So it will give everything answer, and it is based on, see, even it is based from the YouTube part only. So check back the headline count, everything will be coming up, everything will coming up from here only. So this is the like totally negotiable at the start of 20 for 19 Apple verify cycle count for setting and everything. So you will have like anything faster. So this is totally replaceable for the Google. So this is your purpose here. Now if you have already opened your Perplexity, I want you to type this one. Try everyone. Once you try and once you get your answer, just click thumbs up and I'll continue. So what are the latest treatment guidelines for type 2 diabetes in South Asia? Include recent RCTs, side paper, viewed source, academic mode. So here academic mode is means like this one. So when you search for anything, right, especially that goes in the premium version. So let me just go to compare here. No, I don't want this one. So here you can search for the model. Like Perplexity is, you can find Perplexity using all other model, like ChatGPT is here, Gemini Pro is also here, like Cloud AI is, everything is here. But ChatGPT and other tool have their specific purpose, but ChatGPT, it goes for their its own AI tool. So you can search from here, you can do deep research, and of course it's a paid one, but that you can do it, right? So this is the Perplexity part. Okay, so let me move to the now ChatGPT. Everyone knows about ChatGPT, right? But today you will learn two different methods for using ChatGPT, the better one. So we'll use generally like prompt of engine. Like I'll set every slide so that you can copy this prompt and customize according to yourself only. So no need to worry, right? So open your ChatGPT and search for explain regression analysis, one prompt, and another prompt explain regression answer, like using a 5-layer answer model, simple explanation, technical explanation, real example, counter argument, and practical application, and you will see the vast difference the way ChatGPT gives. So let me show you the real example. See here, I just came to ChatGPT, right? Let me just search for explain anemia. On this one, I'll open new tab. Let me just close other tabs so that it will be easy for everyone. I'll open ChatGPT here again. So ChatGPT answer is coming here, right? And don't worry about the AI, because if even if you do like a spelling mistake, AI is AI. That's he or I don't know. Generally, we say AI as a he or she, right? Then AI should know the idea, right? So let me compare side by side with this one. See, when I write explain AI, anemia is the condition where your blood doesn't have enough blood, healthy blood cell or everything. What's happening in your blood? Common symptom, types of anemia, right? And then type of anemia, and then causes and treatment and prevention. It's more like some childish answer, right? Like class 11, like class 10 answer. But if you go here, see, anemia is a condition where blood doesn't have enough healthy blood cell to carry oxygen. Fine. Technical answer, anemia is defined as a reduce in hemoglobin concentration, hematocrit and red blood cell RBC count below normal level. Hemoglobin is oxygen carrying protein, and it's like vitamin B12. Now, see here. The common cause include the common symptom here. A real world example, like imagine your body is like a city and red blood cell are delivering truck carrying oxygen, the fuel to a different area. Now you have this analogy that you can relate and understand better about this topic. Even the counter argument is like not all anime is the same and not all cases are severe. Some people, especially women or people living in high altitude, like in Kathmandu, that's my location. That's why maybe slightly lower hemoglobin level that are still normal for them. See, you will not find this kind of counter argument on this any of this area. And practical application, like how this knowledge help in real life: eat iron rich food, spinach, lentil, and red meat. Now here, do you see anything? It just say iron supplement, iron rich diet. I don't know the example. What are iron rich diet? Vitamin B12 folic acid supplementary include vitamin B C helps in iron absorption, right? Now this I don't know. Like you can it's up to you. Like whether you prefer this answer or this answer. Simple. I didn't change anything. I just changed the way I asked ChatGPT or any AI. So what I just did is like instead of just writing give me this or give me that, like explain anemia or explain what, I just said that explain anemia using 5-layer answer model. So 5-layer answer model is like generally the common one that people use. So I just further give simple explanation, technical explanation, real example, counter argument, and practical. Now let me just change F- Kenya specific. When I say Kenya specific, Kenya. See, when I do the Kenya specific, now what is the anemia in Kenya is a major health issue, especially among children 5, and everything is given, right? So now it is giving about malaria, parasitic, like it is giving all other way of answer. But here, if you see that, it will explain anemia tailoring to the Kenya. In Kenya, anemia is common. Iron deficiency, the woman, the real, it mainly maize diet meal are low in iron, poor school performance. Counter argument is like genetic condition like sickle cell disease. Here, like it's given a different way of approach. So I will not prefer this answer. I'll prefer more to this answer. So this is the best way you can use AI, especially ChatGPT. So if you remember, ChatGPT is mostly for generating some content. Now you have this content ready. Now you can understand in a simple way. You can understand from the technical way. You have a real world example, like why being exposed to mosquito carry malaria have intestinal home. Counter argument is there, like the difference argument from the perspective. You have even practical application, right? So you don't have to do anything, like you don't have to buy premium just to get the premium answer. You just have to change your answer the way you ask, right? So instead of try prompt explain regression analysis, you can try explain regression analysis. You can take a screenshot. I'll also share the like everything. So 5 simple layer model. So 5 simple layer model will give like a research grade breakdown of your topic. So this is how we use ChatGPT. And there's another approach for the using ChatGPT in the same way. So let me just open new chat on both sides. So generally, as we try to find the slide from the ChatGPT, like so we'll do like give me slide for anemia. So when I ask for give me slide for anemia, it will give a slide presentation slide. Now I'll just do your task is to give me slide content for anemia. Use facts, figures, and RAFE references. Use national as well as international example. Slides should be well via verse. AUDIEN's audiences are, so I'm saying audiences like students and healthcare PROFA professionals. Now the difference, you will see the very vast difference the way answer is being provided here. So when you do give me slide for anemia, you will see what anemia is, the cause, the symptom, prevention, everything, nothing. See, now it is being like I'll generate PowerPoint. But if you see here, So slide one, it gives the title, Anemia, a global and national health challenge. A presenter, audiences, date. What is anemia? A condition characterized by reduced hemoglobin or RBC. WHO SB threshold. See, you have now WHO SB threshold. You will not find anything here. It's just like a vague, just providing answer. Now, global burden. The best part, the things that you did in perplexity, like finding the resources, the direct link. When you use facts, figures, and references, it will give you the references of the link. So effect 1.62 billion people globally means 24.8% is pulled from this site, MDPI, from this research, not from the some kind of random one, right? So you now have a more trust. Then you have global prevalence. You have the concrete source from where the data is being pulled. Otherwise, see here, give data also. Now, when you ask give data also, you will not find same data across the both side. Look, sometimes it does the example. So now 1.62 billion people globally, it gives 1.6 billion, right? 1.6, 34% of the women here is like 40%, 36%, bringing 86% case. So you will find little bit of amount of among these two number. So iron deficiency is 50% globally. So South Asia globally, I don't know, 89% iron deficiency I haven't got here, right? So when you just say data, you have no source. I don't know you will trust this kind of amount or not. Now when you say provide source of data, when you do provide source of data, it will, on most of the cases, it will change that data generally, because this data is randomly pulled. It's not more kind of, okay, it's not more kind of data resource focused base. Now you have like different data. See, you have different data, you have different data. Now you have like references. So instead of asking multiple time give source of data, give data, you can do just one this line. When you say your task is to give, now it will focus only on giving like content for the anime. It will not try to pull all other things, because ChatGPT is the collection of everything, right? And you will use facts, figure, and references. Use national as well as international example, so that it will be more related to you when you give the presentation. Because see, here's a global body, here's a South Asia region, here's a Nepal scenario. Now I can talk from the global to my regional to my national. And high risk group, which are the groups, types of anemia I have, the causes I have, and everything is here. And this is the main slide that we want to see, and not this kind of slide. This kind of slide is for class 8 or class 7 guys, grade 7, right? This is the actual researcher slide that should come. And even if you ask for the more references, it will give references. This one, see, index per moon, index unicef, pmc, mdpi, everything. So this is how you use chat gpt. Don't just simply go and ask give me this or give me that. Simple do, you can use this one. You can take a screenshot for now. Or it's simple, you have to always give a context. Try to give as much as context, because when I say the student are student and healthcare profession, it gives according that way. But when you say, like, let's say AUDI audiences are class 5, now it will change the analogy of the ode and everything. See here. Anemia, lack of blood. Anemia means your body doesn't have enough healthy blood. Blood has oxygen carry. See, this is for pale skin, face look like pink, less pink. Slide, not eating healthy food, lack of iron diet. Now it changed the analogy, right? So when you give more context, even for like I did today the presentation, I have to pick a word that is more related to medical term. I cannot give an example using a financial term, right? Instead of I ask give me slide for anemia, or instead of this one, if I search for give me a slide for stock market analysis, that's not relevant to you. So always try to change the way you ask ChatGPT. How? Just give more context. I have given the context. See, slides should be well words. Audience are these. Use national and international example. Use facts, figure, and references. And give slide content for anemia. Your task is like dedicated now. It's not simple like give me anemia. What is anemia? It might be different. So what is DS? Most people, if you are from technical term, you will say data science, right? DS. But if you are from dental, you will say dental surgeon. DS is also dental surgeon. Just because the word is popular in your domain doesn't mean that it is popular all around the world. What is the full form of AI? You will say artificial intelligence because this is the session, right? It might be advanced intelligence. It can be anything. So you should not like pre-assume AI will give you based on you only. You have to ask explicitly. You have to give clear cut way. Okay. Uh, so this is the like especially when you do paper, we'll do this kind of way. Like if I upload some PDF in the chat GPT, I'll just paste this kind of summarize this paper in 5 part: main argument, key evidence, methodology, limitation, and clinical implication for Nepal. And even if you want to do for like say, let's say Kenya, you can change for Kenya and other things. And for RCT appraisal, for grade evidence, based on this evidence, what grade level will you assign, justify using risk of bias, incursion index, and weakness, what are the three best methodology, and I'll just always verify this one. So this is just a prompt you can use whenever you want, right? So now let's move to the illicit part. Okay, till now what I have like today is just like the way we use ChatGPT or Perplexity, that it will be more kind of less, but it should be coming on your daily habit how to use, because that's the main essence of today's session. So now you use illicit. So what illicit is like, if you go to illicit.com, so it is like illicit.com. If you see here illicit.com, so what illicit is like, illicit is your literature review. So when you do previously Google Scholar, so if you go to the Google Scholar and you are doing research on any, let's say, anemia, anemia detection, right? I lost my cursor. Just give me a second. Yeah. If you go to animation, now same, the perplexity replace Google search, the illicit replace Google Scholar. So you have to open this paper, you have to open this paper, you have to open this paper, you have to open this paper. So you have to go through all this paper link, all this paper, all this paper. You have to go lots of paper, right? And I know if you have done research, it's hectic one. Now what you can do, like you can go to illicit, you can just search for anemia detection. And what it does, like it will search on behalf of you to the Google Scholar. So perplexity search the Google, illicit search for the paper. Now it will give all the papers. See here, you can load more and more paper. And what you can, sorry, you will see the paper, the name, the DUI number, and everything is on here. Now it is more relevant to you. Now in order to like, first when I do the research, I always try to find the methodology that I'm going to copy or the limitation of the other paper, so that if I solve that limitation, my research is like kind of nice one, right? So what I'll do, like I'll click on the edit column and I'll add a new column called limitation, and I'll just hit enter. And now what it does, like it will pull all the limitation from every this paper. So not mentioned, the method has the accuracy of 78.9 percentage. Indicator limitation area does not correct identify enemy involved. So this is more kind of machine learning part. So anemia detection means machine learning, right? So when I achieve, at least my model, the machine learning model achieve like let's say 80 percentage, what I'll write like I surpassed this research from I 2017. Their accuracy was 78% and mine is like 80 percentage. So my model is based in that. Here, here, everything. And even if I want, I can add methods, and now I'll see the methods the used by that paper. So what it does, like it will like supercharge your way of finding the paper and doing methodology, the limitation and everything. You don't have to read all the Google Scholar, download the paper, upload option in Zotero, do Google, do print and highlighting and everything. See, design a mechanism for automated detection, use image for conjunctivity, everything is here. Now see, they use AlexNet multiple specialties. I have no idea what does mean this. So I'll just copy this, I'll go to Perplexity, I'll search for this, and now I have like more understanding. I don't have to do Google, I'll get all the answer here only. So that's the essence of Perplexity. That's the essence of illicit. So illicit is your next go-to tool. And there has been a new development in illicit. So instead of find paper, here you have like report. So this is very much beautiful for those, especially student. So here instead of find paper, you will go to the report and you will just search the paper that you wanted to write. So let's say okay, anemia detection among children. So even like 50 sources. Now what it does, what it does simply is that now it will start writing a report for you, looking after the 50 sources itself. You don't have to source the paper, because previously we did that one. Now it will source all the paper, and it will start writing a report. It has already started sourcing, right? The gather source completed. So in within 0.04 second, now it will start preparing the report for us. So we'll come back to this report very soon. So now it is doing the report writing for us. So we'll come back, right? So there's another way you can do, like in illicit, in other patient with hypertension in Nepal. That's a population. You are very popular, like you already know this PICO method, especially in the medical research, right? Does the dash diet compared to the standard dietary diet, reduce systolic blood pressure, or focus on RCT pump. So population intervention comparison and outcome, that's a PICO method, right? So you will use this PICO method, you will just paste in the illicit, and you will get all those paper that is relevant to you. So if you can, like it's like it's doing one. So that's how we use illicit. Now before going to other tool, the notebook LM, I'll jump directly to Gamma app. So if you remember the presentation, the slide we got from this one, see the slide we got from this one. Now I want to create a slide. If I say give me pptx, the chat GPT will do lots of things. It will create a, see, the PowerPoint and all the kind of code in there. I don't want this kind of thing. What I want is like, all I have to do is like, I'll just copy these slides. I'll just copy these slides. And now I'll open Gamma app. So there's another tool called gamma.app, right? Once you open the gamma.app, you will have like kind of credit. So I'll create with AI. So instead of generating, I'll use paste index. Why? The very difference is like when you generate, it will same work like this one of AI. It will not work like this of AI, but it will work more kind of this kind of AI answer. So lame, so like not full of details, not relevant. It's more like just we filling the answer just to in sake of being passed, right? So I'll just paste in the text, and I'll just paste my content here. So I want presentation. I don't want web page. I don't want document. I don't want social. And this graphics new. So it is trying to replace Canva, but it's presentation. So generate from the notes or the outline that I have given, and I'll go to continue to prompt. Now it will work on myself. So it will create how the looks. So I'll change the looks, like it's a minimum or concise or detail. I'll pick concise. And you want tone being clear, concise, authoritative in American English or UK English or British English, or what you want, snowball or indigo or atmosphere, right? So fitness, I prefer snowball methods. You want image, AI images or web images, you can do web images whatever way you want, and you hit create generate. Now it will be start generating. Till then, we'll go back to our illicit, because if you see, these AI tools are like our assistant. So we'll go and check our assistant illicit here. So illicit is doing here. So it has pulled data point extract is 70. It has pulled child column, detection method, reference status, diagnostic, anemia prevalence, implementation factor, study conclusion. It has already pulled. Now it is extracting more data. So it is assembling methodology. So I can see like what is that? Actually 70 data point is contains 10 source utilizing this criteria, right? So it is doing on everything. So I'll go to here. Now it is doing the slide. See here, it is creating the slide. Anemia, a global and national healthcare challenges. What is anemia? I don't want this one. Let me just. So every slide is here. Now the main benefit of this one is like you can double click and you can change here. Now I'll write session by Maladeep Upadhyay. See, I want to change this image. Like, I don't know why I'm losing my cursor again and again today. See, everything is here. What is anemia? You want to change the picture? You want to change the text? Whatever way you want. Pregnant woman, everything is there. So all it does is that the information that you have on this part, on this site, is now presented to on this site. So you want to change the image or you want to search for zoom, whatever you want to delete, you can delete. When you can add the image, you can find the images. Let's say any you can add this one. So you have the image. You want to change anything, you can do totally. Now the slide is ready, right? Everything is ready. You can add more slide or other thing, and you can simply do present. Now it will open the presentation. So by looking at just this, do you feel like this is the AI generated presentation? I don't think you will first look. Now you know it is from AI. That's why you might say this is AI. So see the cause of anemia, iron deficiency, vitamin B12, fluid. It also created the image itself only. Blood loss, menstruation, GI bleeding. I have no idea what is GI bleeding, but infection. Why it matters in Nepal. Now you see all the slides are here, all the slides. It will not take much of your time because you know the information presented in this slide is very much valid. But if you go to the chat GPT, see, it is generating the slide. See the slide chat GPT generated. So lame, nothing, 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 nothing. And I cannot trust. Though information is like kind of good, but I am not going to use this kind of slide. Rather, I'll just go to this slide and I'll just use this slide. Now you have general symptom, everything is here, you can control everything. So this is the essence of using chat gpt. If I have used gamma AI using the generate one line probably any, let me just do that anemia, so it will generate the outline. So now you see the invisible epidemic, millions affected, the oxygen body crisis, a person looking, a root cause, everything is there, right? So I'll just click generated. Now let's see the difference. The way the first information that we provided and by generating with AI only. See, animate the silent drain on vitality. That's so big word, right? 12% women affected, 1.7 billion global cases. I have no idea this data is right or wrong because if you see 20% pregnant women, and if you go and see here, that data is totally different. See, 36% pregnant women. You cannot trust this data, 20%, because you have no idea what the source is. But here you have very much credible source, MDPI. You click on that one, you will see this paper and you can give a reference citing to this paper, the citation part. And you see that there are 20%, instead of 20%, it is 36% pregnant women are globally affected with anemia. You have like concrete answer. So instead of using AI just asking give me this or give me that, you have to first verify the information that it has provided or not. Right. So that's the benefit of this one. Now I think like it's drafting is abstract. So it takes lots of time. It's all now we have here. See, anemia detection among children. Abstract is here, method is here, result is here. Now you will see all the study, whether they have full text or half text, the types of study, the age range among those study, the sample size they use, the setting where the study was done, the geographical location, detection method, and reference strategy here. Now you will see all this text. All these texts are based on those 50 sources found. Then 10 sources were included and 70 data points were created. Now you have at least what to write on your report. You have the references. You can download as a beep, download as a txt, download as a ras, and you can generate like whether you want to go Jotero or whatever path you want to go. Now you have like multi-site exams, static exam, single automatic site, but it's a multiple site subjective or difference in sensitivity. The Ethiopian study found Palmer Pallon alone had 50% sensitivity, which increased 70% when combined with conjunctival Pallor. See the Brazil study, and you have all the paper sources here. Now you will see, if you click on this one, you will see from where it pulled the data. If you click on this one, from where it pulled the data. Now you have report completed. All you have to do is copy this data, use your own English or paraphrase using AI, and you have your report already ready, the research focus report, and you have the valid sources also, the valid 10 sources already. If you buy the premium upgrade, then you will have like more control, but free version, it works. So that's the essence of illicit. So illicit is like more kind of removing the Google Scholar part in a much better way. Right now, going to this one, see, I will not trust all this data. See, general, severe, I will not trust this kind of data. This slide, that's fine. But using the chat GPT, using this prompt, just simple, like whenever you chat GPT, all you have to do is like use just this line, you will get better answer. So that's the way you use Gamma AI. You use Gamma AI and you have your more answer, right? So for the notebook, and other things, so let's just move to other part. So the complete medical research pipeline is like, for finding the source, you go for the perplexity. For getting the paper, you go the illicit. Similarly, there is a illicit like other tool called consensus AI. Same way, but it's your preference. And if you are more into like you all are into medical, right? Consensus AI. If you want more kind of medical term, especially medical research paper, this consensus AI is your main tool. I use illicit also work fine, but consensus is more kind of thing. So it will go all over the paper or just medical journal only. We don't have that kind of features in illicit, but here you have that paper. So consensus AI is your and the tool. There are lots of other tool. You can pick whatever tool, whatever. Like if you scroll your YouTube, you will see top 10 tool every AI medical should read or use. But it's you that should pick your AI tool, not some other guy, right? So you can try illicit, you can try consensus, and it's your tool. Then you have like notebook LM is like more kind of having the same thing in all everything. So this is the notebook LM from Google. The main essence of notebook LM is like you will get multiple tool. Let's say this is the source. You search here, it's more kind of perplexity on this side. So this person is like perplexity. This is the chat GPT version. You will like chat with your paper and everything, right? And this is your like other AI tool. Like if you want to create a slide, you can go and create a slide deck. If you want to create a report like illicit, you create on the report. If you want to create other AI tool like infographics, you click infographics. So notebook LM, when you understand all other tool, then notebook LM is your main tool, like common tool. So you can upload your source. Like let's say I lost my cursor again. I don't know why I'm losing my cursor. So here, okay. If you search for anemia, it will search in the website, the perplexity part. Here you can chat with your paper uploaded or everything here, right? Here you will generate lots of things and everything. So that's the essence of notebook LM. And I cannot teach notebook LM now only. You have to always try to work with notebook LM, try to see and everything. You import and now you have all these sources here. Now you can have a conversation. Like same like illicit, we source for the 10 so 50 sources. You have a conversation, you have a report, similar way you can do. You get to infographics, you can even create a podcast. If you remember the two people speaking podcast, it's generated from here. You can upload your assignment and you can create audio overview and you will get your podcast ready from the notebook and in free of cost only, right? So that's you, this is your task to do notebook and there's one very beautiful tool I really want to teach you guys, napkin AI. So this napkin AI is more kind of generating infographics. Let me just sign in with Gmail. So you want to create an infographic. Let's say you want to create this infographics. I just copy this text, right? Copy this text. You go to the napkin.ai. Let me just do sign up thing and everything. You go to the napkin.ai and you just paste the text and you have your everything is ready. This is one of the most beautiful tools that I really like, the power of AI. So I'll just create, I don't want plan. I don't want plan, not today. Okay, let's show me the plan. Find by me, back to the app. See. Now I'll just paste the text here and I'll just select the text and here you will see a same symbol. See, you will paste the text and you will see this kind of symbol. If you click this symbol, now based on this text, it will start generating the infographics. See, in the conversation way. You want to create this one, you want to create this graph, you want to create this graph, you want to create this graph, or what kind of graph you want to create. The process, the brainstorming part of all. Let's say generally I'll prefer this one. If you click on this one, you will see more its relevancy. So I'll go and click this one, right? And now I want to tell you how to address anywhere not. What is anemia? I want to change this text. I'll just say supplements, blah blah. I want to change this text. I'll just start anything. Now this is ready, and I'll just click screenshot or you can create export visual and you have your image as a downloaded part. Now you have your visual already ready here. See, now you have your visual. Who will think that you generated this from AI? This saves life. Like this is like instead of Canva, you have visual. So you will generate lots of library. You will see in library also you can paste whatever text you want. Like let's say I just paste this text, napkin.ai, and I'll click on select on this, and now it will create this one. See what kind of graph you want. You want this one, this one, this one. I am okay with this one. See, AI impact Nepali children, anemia, special variants, associated factor health program. I have this one. I want to change any text. You change all the text. You want to change the font. You can click on the fonts and you can change to Monstrate. Now you have changed your font. So that's the one, right? So now I'm like about to so back of the wind. Now the main thing like you have to remember, it's not about AI tool. It's always about what AI can do and what AI can't do, right? AI can read table, spot table, pattern, and summarize and everything, but it can never, never, never guarantee accuracy. It can never understand your specific context, and it can never replace domain expertise. So you pull the content from the AI, but you have to always do double verification. You have to bring the question, you have to bring the context, you have to bring your judgment. And and only AI is like it brings your speed and pattern. I don't know whether you believe or not. I completed my master thesis within 1 week. I use this AI tool. I use this AI tool and I completed within 1 week only my entire master research. And I splitted my master thesis into three paper only using AI. But that's my contour, right? So AI with AI analysis, it's trustworthy as data you give, right? So remember, hallucination happen. Hallucination means AI giving the answer that's never exists in the internet. It just give data because it's based on the pattern. So ChatGPT is like kind of always
Maybe.
hallucinating.
Yeah, I'm in a Zoom meeting.
And there is like bias in bias out. If you say AI summarize something, like I don't know whether how many of you feel okay with me or not, but if you say like a business person, if you search for the business person, see, you will see variety of images here, right? If you see for doctor, South Asia, see, you will see Dr. South Asia, especially now the biasness has changed. Previously, you will see all kind of, especially Chinese, like especially Korean, Chinese, Japanese. You will see as a South Asian doctor. You will not see like Indian as a South Asian doctor. Even if you see this image, this is not from the South Asian doctor. It comes from Facebook and other thing. But the image Google is giving, it's kind of bias. So bias happens, but it's you who should like see whether that's bias or not, and never upload your patient's data in ChatGPT. Most of the medical research, what they do, like they upload patient data and try to analyze with ChatGPT. No, that's totally wrong. You should use Julius AI. You should anonymize your patients. Instead of patient, let's say Maladip, you have to write M1, M2, right? And when you have to stop using AI, is like when AI gives contradictory answers, or when AI is giving the answer that you feel no, it doesn't make any sense, you have to stop using AI and you have to have a manual task done, like search Google manually and do everything. So the main essence is like AI authorship policy. There are lots of AI authorship policy you as a researcher should know. ICMJ. So AI cannot be listed as the author. You should never list it as author, and you should always try to have a track of how you find that information using AI. And there's a very popular HIPAA law, HIPAA compliance. Every medical scholar, researcher, health researcher should know. This is HIPAA law is for American law, and GDPR is for European. So if you are dealing with any American patients or European patient, if you do not follow HIPAA or GDPR, then you will be like very much sued by like billions of dollars. Hallucination, I already talked, and there is always journal guideline how to use AI and everything. And there's always institution guideline. If you work in the university or any institute, they have their how to use AI and everything. So most people treat AI like a search engine. They type the question and hope for the answer. That's totally wrong. You should treat AI like your high level consultant. You ask the question, you ask the why the question, the answer is coming, you ask the sources, You ask multiple time that AI feels like every time you ask why, AI give the right answer. And I see in chat in tool, they have asked for the master AI directory, right? This is the AI directory for phase and tool. Literature, illicit, literature, consensus, literature, research David is there. And there is another one cognitive paper. If you are doing like multiple cross-sectional research or longitudinal research and other thing, cognitive paper is one good tool. Analysis, Julius AI. I haven't went through it because Julius AI very weak. Analysis, ChatGPT or Cloud AI, that's very good one. Visualization, napkin.ai we just did. Biorender is another one. Writing, PaperPal is there. Writing Grammarly is there because grammar and everything, right? Citation, Scicit AI. There's an AI tool. Zotero with AI, everything. So submission, LCFS, journal finder, post, pop, altmetric, and everything. So this is the AI tool that you can do. And with this, I'll wrap up my session and I'll go through the question answer out. So if you want to learn more about the AI and everything, you can connect me in the LinkedIn or you can read my blog at the medium.com, and or you can connect me in the Instagram with the data with Mala. With this, thank you very much for your attention. And now I'll try to answer a few questions before I give my podium to Isaac. So it's illicit the app. I think Siri already answered. Siri, illicit the website. So remember, never try to go and see as an app. Never try to use this kind of AI tool in mobile. Only Perplexity is very best for the mobile because it's replaced Google search. So Perplexity, I also have a mobile app, right? But other tools you always try to use in the like laptop because it is main essence. All AI tool are main essentially built for laptop, especially research AI tool. So despite ChatGPT, can I please get a list of all the AI tool? So these are the AI tools that you can get. And if you follow me on Instagram or TikTok, I keep posting AI tool, the prompt and everything on that side. And also I have a prompt ebook for medical researchers, especially they can use across the research like entire pipeline. I'll also share that with you all guys through the email. And I don't think there's any other questions. So with this, thank you very much for your attention from whenever you are. And as a WMI scholar myself, I am so proud of this family. And thank you very much for inviting me to Medical Scholar and sharing about my experience. Thank you very much, guys. And Isaac, the stage is yours.
Thank you. Thank you, Mala. It was enlightening presentation. Thank you everyone for attending this. Now it's time to wrap up our session. Isaac, all yours.
Okay, thank you so very much, Mala. That was an amazing session. I've learned a lot, and I believe our attendees have equally learned a lot. Yeah, so we would want to take questions. I think um, there was only one question in the chat box which you have answered, but if you do have any question, kindly put up your hand and we'll call you for you to ask your question. It's been an amazing session. We are going to share the slide with you on our page. We are also going to upload this recorded version onto the BMI YouTube channel. Then we would share with you. So if you do have any question, kindly just use the raise hand icon and we'll call it to you for you to ask your question. We are still waiting for your questions. If you do have any questions, Favor, do you have any question? Okay, so while we are waiting for questions, let me quickly appreciate the presence of some WMI scholars. We have Dr. Onisai Chikubare. She was last year's scholar ambassador. We want to appreciate her presence here. We also have Dr. Justice Osemedi from Nigeria. He is part of the Medical Scholar Board. Yes, I think I saw Dr. Angela on the call, I think, but she's dropped off. Yeah. So thank you so very much, Onisai, for joining our session today. We hope that you've learned a lot from the session. We are still taking questions. If you do have any question, please can chat directly in the chat box, or you can use the raise hand icon. I'll call you, then you ask your question. You have just 2 minutes to ask a question. Other than that, I think Dr. Dikshanta, you can um, take charge. We appreciate our presenter, then we call it a day. Over to you, Dr. Dikshanta.
Thank you, Isaac. So it was a really nice presentation. Thank you, everyone, for attending the session. And this was a very important session, especially for the medical scholars who are interested in research and publications. So hope you learn a lot from today's presentation. And I'd like to thank Mala, so who is a very good friend of mine, and we're also work together in WMI Nepal. So thank you, Mala, for teaching us many things regarding AI. I always love learning from you. We'll come with the next session, especially. I think last session of this year's Medical Scholar Board, in few months, it's about research. So I think it's about data analytics or something with medical data, clinical data. So, and if you have any questions, please kindly ask the questions in the WMI Medical Scholar community or WMI Professional Medical Professional WhatsApp group, and we'll answer the questions. And thank you, Isaac, for making time for this presentation. Thank you.
Just a quick one before we close. We are going to have another session this month. We are going to talk about money, finances, managing your personal finances. That will be on the 26th of April. So please be on the lookout when we start the session. Please do join. Okay. Have an amazing week ahead of you. Thank you so very much once again, Dr. Mala. We appreciate your presence and your session. Like he stated, we are going to share the slides with all of us so that we can better use it. Thank you once again, and do have a wonderful day. Bye.
Bye.